Okay, good afternoon. Today you can see we are on time. It's a Friday and we want to give you time too. But even if we give you time, where are you going to go? Because you can't move out of Nairobi, isn't it? Anyway, good afternoon and welcome to today's briefing on COVID-19. Today, we join our brothers and sisters across the globe in marking World Sickle Cell Diseases Day. This day is commemorated on June 19th all over the world. The United Nations General Assembly established the World Sickle Cell Day in the year 2008 to increase public knowledge and raise awareness of this important disease called sickle cell disease. This year's theme is Break the Silence, Shine the Light on Sickle Cell Disease. This day is meant to highlight the struggles of living with sickle cell disease sufferers and their caregivers. Sickle cell is a genetic disease characterized by a mutation in the gene encoding hemoglobin within the red cells. And the result of this mutation is that the red cell loses its smooth circular shape and often assumes a crescent shape, which then results in the blockage of small blood vessels because it cannot move as smoothly as the round shape, so it ends up blocking small blood vessels and capillaries. As a result, individuals with this sickle cell disease often experience chronic debilitating pain, risks of recurrent infections, and other serious complications. Persons living with sickle cell disease are at a higher risk of getting infected with COVID-19 and more likely to get severe illness if they get infected. This is due to their impaired immunity resulting from their blood disorder. People living with sickle cell disease should therefore strictly observe the precautionary preventive measures for COVID-19. During this period of coronavirus pandemic, persons living with sickle cell disease are advised to ensure that they keep a minimum of 1 month supply of medication at all times. In addition, they should consult their healthcare providers should they experience COVID-19 symptoms. At least 240,000 children in Africa are born each year with sickle cell disease. Here in Kenya, it is estimated that 6,000 children are born with the disease. Sadly, between 50 to 80% of these children die before their 5th birthday. The recurrent pain and complications caused by the disease can interfere with many aspects of the patient's life, including education, employment, and psychosocial development. Interventions to control the disease include early diagnosis, provision of prompt and effective management, advocacy, communication and social mobilization for screening and genetic counseling, as well as during premarital courtship. I'm glad to note that the ministry, together with stakeholders, have developed guidelines for managing the disease, guidelines that will be rolled out very soon. This will help us improve the quality of care offered at our health facilities and community levels. I want to thank all stakeholders and partners who have supported the ministry to commemorate this day particularly the Sickle Cell Federation of Kenya and Novartis. We are also grateful to the Public Health Club medical students at the University of Nairobi who have mobilized their colleagues to donate blood for the management of sickle disease, which is one of the ways of managing sickle disease. Also involves transfusion of blood when required. Fellow Kenyans, let me now move to the numbers for our COVID-19 over the past 24 hours. We have 117 people who have tested positive for coronavirus disease over the past 24 hours from a sample size of 3,043. The new positive cases pushes now our confirmed cases to 4,374. The total tests carried out so far are 133,541. Of these 117 positive cases being reported today, 112 are Kenyans and 5 are foreigners. The age ranges from 11 years to 75 years. 83 are males, 54 are females. In terms of distribution by county, these 117 are distributed as follows. Nairobi 51 cases, Mombasa 22, Kajiado 18, Kiambu 6, Nakuru 5, Garissa 5, Machakos 3, Kericho, Busia and Uasin Gishu 2 cases each, and Wajir 1 case. Below the counties at the sub-county level, we look at Nairobi. The 52 cases come from Kibra 8, Langata 8, Makadara 6, Dagoretti North 6, Kamkunji 4, Embakasi East 4, Embakasi North 3, Embakasi South 3, Mathare 2, Ruaraka 2, Embakasi Central 2, Embakasi West, Starehe and Kasarani 1 case each. Mombasa's 22 cases come from Mvita 8, Kisauni 5, Changamwe 4, Likoni 3, Jomvu and Nyali 1 case each. In Kajiado, the 18 cases recorded are from Loitoktok 12, Kajiado Central and Kajiado East 2 cases each, Kajiado North and Kajiado West 1 case each. In Kiambu, the 6 cases are from Thika 3, Kiambu Town, Limuru and Lari 1 case each. In Nakuru, all 5 cases reported are from Naivasha. And in Garissa, the 5 cases in Garissa are from Dadaab refugee camp. In Machakos, the 3 cases are from Athi River. In Kericho, the 2 cases are from Ainamoi, while in Busia, the 2 cases are from Teso North and Matayos. In Uasin Gishu, the 2 cases are from Kapseret and Soi, while the 1 case in Wajir is from Wajir West. I'm also pleased to inform you that we have discharged 91 patients from our various hospitals, bringing the total number of recoveries to 1,550. I want once again to thank our healthcare workers for the excellent work that they are doing out there. However, on a sad note, unfortunately, we have lost 2 patients to the disease, bringing the total fatality to 119. We send our deepest condolences to the family, friends of the departed. Finally, as you can see clearly from the numbers above, the spread of the virus is concentrated in some areas. Some areas, especially within the epicenters of these two large metropolitan urban and peri-urban areas of Nairobi and Mombasa. This could be attributed to change in behavior in some of these areas. For instance, we are aware that in certain parts of the city here, especially in some of the suburbs such as Westlands, Lavington, Kileleshwa, and Hurlingham, we are seeing increasing number of young people congregating in groups and organizing gatherings such as house parties in some of these areas. We caution that this is recipe for disaster, because that is when the virus is spread, when people get together and do not take the necessary measures and cautions that we have been preaching out here. This could well be some of the reasons why we begin to see increasing numbers in some of these areas. And again, we want to appeal to these young people and any others who may be flouting the rules, the regulations that have been put in place, not observing the containment measures, that we will stand the risk of igniting the spread of this virus in these regions. These activities are being conducted with little regard to social distancing requirement. I want to remind Kenyans that avoidance of social gatherings of any form, whether it is a religious or political or an entertainment gathering, is prohibited and is one of the measures of containment for coronavirus pandemic. I therefore want to appeal to our people to take individual responsibility in observing the measures that have been advocated by the ministry, and failure to which we will only see escalation of the number of infected within the country. I thank you all.